Good evening, everyone, and welcome. My name is Carl Sciortino. I'm the VP of Government and Community Relations here at Fenway Health. Tonight, we have a really important program to tackle one of the many issues that the Trump administration is throwing at us in the last couple of years and give you all some tools to fight back and be a part of the solution. If you don't know Fenway Health, we are majority LGBT community health center in terms of the patients that we serve. Over 50% of our patients here are from the LGBT community, including almost 4,000 transgender individuals that get care and services here with us through a variety of programs. And as a health center, we make it our mission not just to provide high quality care, which we take great pride in, but also to make sure that we're a part of the broader community conversations about the impact on the lives of our community members and the lives of our patients and those we serve. And that takes the form of direct lobbying and advocacy, community engagement, community education, and that's what we're going to be doing here tonight. For those of you that were following the campaigns this past fall, with the Yes on 3 victory, we were able to defeat the repeal of the transgender non-discrimination law. And I would say in Massachusetts, generally, we're pretty fortunate to have policies moving in the right direction. Never as fast as we want. We still always have progress to make, whether it's for our LGBT elders or youth or lots of issues that are still confronting people in the trans community and others. But I also just feel great pride that we can be in a place where we can even have these kinds of conversations and we can be a part of the resistance and trying to figure out how to push back at what's happening nationally. And if there's anything the LGBT community knows how to do, it's to fight for our rights and make progress over the long haul. And that's what we're going to keep doing in the face of some really vicious attacks on our community, but we know how to fight and we're going to keep winning in the long run. So if you signed in, there's an option when you sign in to check a box to receive our action alerts so we can keep you abreast of other activities and things that are happening in the state and federal government, things that you can get involved in as well. So please check that off if you're interested in getting more regular updates from us. We don't deluge inboxes. We send maybe one email a month through that system. I promise you it's not a lot, but it'll be a great way to get updated on what's happening. So for tonight, we're going to have an overview of the 1557 rule, the technical piece of what is this that the Trump administration is proposing doing and what the rollback means for our community broadly at the national level, as well as what's happening here in Massachusetts. And we'll end with a tool that you can take for yourselves to be a part of the solution and why that's important to do and how you can help spread the word to people in the community as well. So welcome. Thank you for being a part of the program and a part of the solution, a part of the resistance. And I will turn it over now to Sean Cahill. Sean is our Director of Health Policy Research here at Fenway Health at the Fenway Institute. So Sean, thank you.
Thank you. Thank you everyone for coming. Let's see here. So I'm going to talk just briefly about the policies that are being, that the Trump administration is proposing to change. So the most prominent one is Section 1557 of the Affordable Care Act. This is the non-discrimination provision of the ACA, and it prohibits discrimination based on race, color, national origin, sex, age, and disability in health programs and activities receiving federal financial assistance. These are all characteristics protected under federal non-discrimination law. As you'll notice, sexual orientation and gender identity are not in this list. But we have about 15 years of federal court rulings and Equal Employment Opportunity Commission rulings that have interpreted sex discrimination prohibitions in federal law, which include the Civil Rights Act of 1964 and the Education Amendments of 1972. That sex discrimination language has been interpreted to prohibit anti-transgender discrimination. It has also been interpreted to prohibit some kinds of anti-gay, lesbian, and bisexual discrimination that constitutes sex stereotyping. So this, for example, could include a lesbian couple who seeks assistance with fertility and is told, I'm not going to help you because I think a woman should only have a child with a man, or I think every child needs a mother and a father, and so I'm not going to help you, a lesbian couple, have children. That would constitute anti-lesbian, anti-gay discrimination that is a form of sex stereotyping. So in 2016, the Obama administration issued a rule implementing Section 1557 of the Affordable Care Act, which was passed in 2010. And the final rule states how Section 1557 is to be implemented and enforced by the Federal Department of Health and Human Services. It explicitly prohibits gender identity discrimination, which is very exciting and a huge advancement. It also explicitly prohibits discrimination against intersex people and non-binary people. And this is across federally funded healthcare programs. It also provides some protection for gay, lesbian, and bisexual people, prohibiting certain kinds of sexual orientation discrimination that take the form of sex stereotyping. So this rule helped expand healthcare access for LGBT people in healthcare facilities across the United States. Now the Trump administration is proposing a new rule to reverse the 2016 rule. And if finalized, this proposed rule would eliminate non-discrimination provisions related to gender identity, sex stereotypes, and termination of pregnancy. Some of the media coverage of this proposed rule, which the Trump administration actually floated in late May and then officially proposed in mid-June, has portrayed it as anti-transgender, and it is absolutely anti-transgender. And the protections in the 1557 rule for transgender people are more robust than the protections in that rule for gay, lesbian, and bisexual people. But actually what the Trump administration is proposing goes beyond just the 1557 rule and goes beyond just attacking transgender people. So I'm going to sort of explain that now. This rule would also remove sexual orientation and gender identity non-discrimination language, very explicit SOGI language, from 6 other healthcare regulations. These include regulations governing health insurance exchanges. Those are the federal and state exchanges where you can purchase health insurance, most of which is subsidized health insurance. So about 10.5 million Americans have insurance through those health insurance exchanges. And those policies are called qualified health plans. So there's regulations in those governing the qualified health plans, governing the exchanges that say you can't discriminate on the basis of sexual orientation or gender identity. They want to pull that language out of those regulations. There are 3 regulations related to Medicaid. One governs enrollment in Medicaid, one governs availability of services, and one encourages states to engage in cultural competency training of providers providing care to Medicaid patients to ensure that LGBT patients get affirming, non-discriminatory, culturally competent care. About 74 million Americans get their health care through the Medicaid program, including a couple of million people in Massachusetts through Mass Health, I think about 2 million people. And then finally, there are regulations governing access to PACE services. PACE is the Program for All-Inclusive Care for the Elderly. And I'll talk about this program in a second. So the PACE program provides health care and social services for frail elders who are still living in the community. So these are generally people with disabilities. They're very low income. They're nursing home eligible, but it's preferable for their own well-being to keep them in the community as long as possible. Most people want to stay in their apartments, in their homes, not go into a nursing home or long-term care facility as long as possible. These folks they get social services but also health care through the PACE program. So we're very concerned that this pulling non-discrimination language out of the PACE program will exacerbate a problem that we already know exists among LGBT older adults, which is social isolation. Many LGBT adults are single, older adults are single. They may be estranged from their family of origin. Many of them are afraid of experiencing discrimination from formal care providers like a home care aide that comes into their home or from a senior center. So they don't access those services. There's data that indicate that LGBT elders are less likely to access mainstream elder services, even though they're probably more likely to need those services. So we're very concerned about what this could mean. This is important because there's a lot of data that show that LGBT people across the age spectrum face discrimination in healthcare, ranging from verbal and physical harassment to denial of treatment. And this discrimination acts as a barrier to necessary preventive and emergency care. So a couple of surveys that document this. The National U.S. Transgender Discrimination Survey, which is a survey of about 28,000 transgender Americans, found that about a third of respondents had experienced discrimination in healthcare, and about a quarter chose to forego necessary healthcare due to fear of discrimination. We did a survey here in Massachusetts with about 450 transgender residents and found similar findings, high rates of discrimination in public accommodations, including health centers, hospitals, health clinics, and that affected people's physical and mental health and well-being, but it also caused them not to seek health care subsequent to that experience of discrimination. Then the Center for American Progress did a survey, which they published last year, that found that among LGBT people who experienced discrimination in healthcare, 14%, this is a national sample, 14% avoided necessary medical care and 17% avoided preventive care. Now here's some data about why the PACE program is important to older adults. So this is a survey that AARP did of middle-aged and older Americans, and found that 3/4 of LGBT Americans who are middle-aged or older are worried about having adequate family and or social supports to rely on. Most of them don't have access to LGBT-specific senior services like we have in many communities here in Massachusetts, thanks to the LGBT Aging Project and our statewide LGBT Aging Commission. Many are concerned about experiencing neglect and abuse in long-term care in nursing homes and other assisted living facilities. And a majority are worried about experiencing discrimination and culturally incompetent care, including health care as an elder person. So this is why retaining that non-discrimination language in the PACE regulation is so critical. Now, the Department of Health and Human Services does not have the power to change Section 1557 language in the ACA through this rule. Only Congress can change that, and thankfully Congress is divided now and is not necessarily going to, vote to remove the language in the ACA, Section 1557. The law cites previous federal civil rights non-discrimination legislation, and the Trump administration can't, by its action, reverse a decade and a half of federal jurisprudence, those court cases and EEOC decisions that I mentioned that interpret sex discrimination to encompass some kinds of anti-LGBT discrimination. But even so, we think that the proposed rule will promote discrimination, will stoke fear, will discourage patients from accessing care, and will cause confusion and legal uncertainty across the healthcare industry. Here at the Fenway Institute, we've been doing a lot of training with health centers. We have a project called the National LGBT Health Education Center. And since 2011, we've been working with the 1,400 community health centers across the United States that provide care to about 25 million Americans. Actually, I think it's like 28 million now. And we've been training those health centers to know how to provide care to LGBT patients so that a transgender or bisexual patient can walk into a health center anywhere in the country, not just in Los Angeles and Washington, D.C., but in rural areas, in very conservative parts of the country, and receive affirming quality care as an openly LGBT person. But we're in doing that work, there's a lot of support for that work in the healthcare sector, and by the professional associations like the American Medical Association, the Joint Commission, which accredits healthcare facilities. They're very supportive of the work, but there's always some people who oppose it, who don't understand why are we treating LGBT people, specially, or we treat everybody the same. We don't want to ask people about their sexual orientation, gender identity, even though it's important for a provider to know that. So we're concerned that this will embolden people who oppose this work to sort of speak out, to try to stop it, to say, well, the federal government doesn't support it now, so we don't have to do it at our health center. And we're very concerned about what that could mean. So just a little bit more about what's going on in Massachusetts and what we think will happen here. So as Carl mentioned, we passed a gender identity and non-discrimination law covering public accommodations, which include health centers like Fenway Health. This was reaffirmed by the voters of Massachusetts by more than a 2-to-1 margin last November. And so that law is still in effect. So our state law protects transgender people and lesbian, gay, and bisexual people against discrimination. And we also know that about 70% of Massachusetts voters support non-discrimination for our community. Key stakeholders are already speaking out, including local folks like Attorney General Maura Healey, many Massachusetts professional associations and coalitions like the Mass League of Community Health Centers, health insurance plans. We're engaging some of these organizations to encourage them to speak out. We've also been engaging some of the national health professional organizations to encourage them to submit comments and kind of resist and push back against this proposed rule change. We're very active in the Massachusetts Transgender Health Coalition, both Fenway and the AIDS Action Committee. And right now, our focus is on mobilizing public comments between now and August 13th. We're trying to get as many public comments as possible. And once that's done, we're going to shift toward engaging, focusing more on at the state level here, engaging the major private insurance companies, the State Division of Insurance, and Mass Health to ensure continued coverage of transgender healthcare needs in particular. So I'm now going to turn it over to my colleague, Carrie Richgels, who's going to talk more about what you can do. And then in the Q&A, if there's any questions about sort of how this will play out here in Massachusetts, we can discuss that.
Thanks, Sean. Hi, everybody. So first, I just want to thank everybody for coming and just reiterate that if you haven't gotten the sign-in sheet, I'm not quite sure where it ended up. Excellent. Be sure to get your email on there, and if you're interested in staying in the loop with our other advocacy efforts and updates on this, be sure to check that box so that we can stay in communication. And I also wanted to thank Liz Gantz, who's here from State Senator Julian Sears' office. And is Irina here? Not yet, but just to reiterate what Sean said, that we have a lot of support in the state of Massachusetts for the LGBTQ community to be able to resource or to be able to access healthcare resources. We have great allies in this state and also at the national level. Later on, we're going to have some staff from Ayanna Presley's office join us. So there's definitely support in Massachusetts for protecting non-discrimination against LGBTQ people in the healthcare setting. So we are hoping that you can all stay and submit comments. How do I go to the next?
Press the arrow on the keyboard.
Oh, okay.
Press that little arrow. Yeah.
Thanks. So like Sean said, we're really focused on getting people to submit comment before the deadline on August 13th. And this can be done at the federal website, but then we also have some computers set up outside for you guys to do it through a couple of other organizations that have some guiding questions that we're going to go over in a second. And I just want to go over the power of comments. So Sean, do you know how many comments have been submitted so far? No? Okay. Well, the idea is that HHS has to go through all of those comments before they can take the next step. So the more comments we generate, the more time we have before the next steps go into place. And they have to go through each and every comment. So you wanted to make sure that your comments are unique, up to 33%. So even if this does go through, the power of comments is twofold. Like I said, it buys time, but it's also important for future litigation. And it's all part of the record. If someone were to bring a case, a discrimination case, against a healthcare entity, your comments create a record that HHS should have had to address these issues before it got to that point. So their government agencies are required to consider public comments. And I know with the slew of things going on at the federal level, you feel like throwing your comments onto a big pile, but they really do matter. And it's an opportunity to have your voice be heard and to affect future cases that might come up. And I just wanted to go back to the point that Sean made about the goals of the administration with this are focusing on sowing confusion and discouraging people from seeking, whoa, this moves. And discouraging people from seeking services and protections that they're entitled to. So I just wanted to make sure that we emphasize that in Massachusetts we have lots of protections in place. If somebody does experience discrimination, that's where the public comments come into place. So your comments do matter greatly. Oh, and a note on the PACE program that Sean mentioned. I just confirmed with Carl that last session there was some legislation that was passed that ensures that there's LGBTQ cultural competency training for staff who work within elder services. And, pardon? In Massachusetts. And that was just affirmed in the budget language that just passed as well. So we have a lot of great protections in Massachusetts, which is not to say that it doesn't happen, but there are tools and support available in the state. When you're thinking about public comments, these are just some messaging points that folks have been bringing up, that there's no place for discrimination in healthcare, and the patient's health should always come first. Discrimination and stereotypes should never be allowed to determine the care that a patient receives. I won't read the whole thing for you guys. You can read this. But if you guys need talking points for your comments, did some people bring laptops? I see a couple of them. Okay, well, we have a bunch outside. These next few slides are just some additional resources. If you guys want to check them out after this presentation, we can send this out to you if your email's on the sign-in sheet. And I, again, just want to end before we have questions to just reassure people that the goal of this rule change proposal and a lot of the stuff that's coming out of the Trump administration is to sow confusion and to discourage people. And I just want to reemphasize that there are robust protections in Massachusetts. And as Sean said, the healthcare setting is really moving towards embracing non-discrimination in all of their settings. And most people in this state support SOGI laws and anti-discrimination protections. So there's been a lot of movement with these comments from other organizations, as Sean mentioned, and we're glad that you're here to submit your own and make this even more of a robust comment collection period. So does anybody have questions that Sean can answer?
I'll just mention one other resource as well. Katie Florida is one of the audience members, and she is actually the author of this tweet that we have on our website called "New Rule Proposes Removal of LGBT Non-Discrimination Provisions in Section 1557 and Other Healthcare Regulations." Very wonky, not very catchy, but it's a great 6 or 8 page summary of what's going on, and it has lots of citations and data points that you can cite in support of your argument. So feel free to post language from that. Just as Carrie said, try to make sure that your comment is at least 33% unique in terms of the language. So use language from us, but just rework some of the words and add your own original content as well.
If it's not unique, then they lump
If
it
it's not
together
unique,
with the
they'll
other
just sort of
ones.
lump it together, and they won't consider it a unique comment, and they won't give it as much credence and attention as they otherwise would. So, but any questions about anything we said or anything we didn't get touch on? Yes, sorry.
Just want to double check, I understand Fenway is preparing their own comments and maybe looking for institutional sign-on from folks across.
Yeah. Yeah, so that's right. So we've drafted a comment, and a number of about a half a dozen groups have co-sponsored the event tonight, including. You just mentioned the Center for
Transgender Medicine and Surgery at Boston.
Yeah, Center for Transgender Medicine and Surgery at Boston University Medical Center, and also Beth-Israel Deaconess Medical Center co-sponsored the event tonight, and Ethos, Streets and Television Services organization. So some of those groups are going to sign on to our comment, and if you work at an institution that would be able to review a letter and run it up the flagpole in a couple of days and get an institutional commitment, talk to me at the end of this, or just give me your email, and we'll send it to you tomorrow morning, and you'd be welcome. We very much welcome your signing on as well, institutional. So MGH or any other organization here. I guess one other thing I'll just mention is just a little bit about Medicaid and Medicare coverage, because those are some of the questions I had after this came out. Right now, 18 state Medicaid. So Medicaid is a federal and state partnership. It's federally funded, and then there's a state match or a state contribution. It's not always a match. In some states, it's only 33%. In other states, it's 50%. But 18 states, Medicaid covers transgender health care. And that's true of 5 of the 6 New England states. All of the New England states except Maine cover transgender health care through Medicaid. And then Medicare covers transgender health care on a case-by-case basis. But it has been covering transgender health care needs, including hormones and surgery, for several years now. We'll be engaging with Mass Health to try to ensure that that continues for the Massachusetts Medicaid program going forward, despite even if this rule change goes through. Any other questions or comments? Yeah.
Can you say more what people will see on these links from their laptop, or if they
Yes.
share these online afterwards?
Yes. Yep. So these are 2 other portals that you can use to submit comment, and they're going to prompt you with some questions. So you just want to make sure that you're stating your name and clearly why you're submitting this comment, that you're against the proposed rule. And then just a little bit about why. And why it's important to you that transgender people can access health care without discrimination. So if you have a personal story that you're willing to share, this is a good place to do it. It doesn't have to be long and detailed if you're not comfortable with that, but just something to let them know that as a resident of Massachusetts and this country, that you're opposed to this rule for that reason. Share a time that you or somebody you know faced discrimination. And then if you can provide details, that's always, when and where. And then how did it make you feel after it happened? Because I feel like when advocating, data points are good, but telling a personal story is always a really good way to sway somebody on a topic. So talking about how this affected you and how you felt when it happened. Did you share it with anyone afterwards? And did you avoid seeking health care afterwards because you were worried about being discriminated against again? I think that's another major one. And then to conclude, just restate your position to be clear. Oh, and that's it.